Hello, everyone. My name is Bhargav Gorti. I'm a senior majoring in biochemistry. I have been conducting research in the Department of Orthopedic Surgery under the guidance of Dr. Daniel Ladd for 4 years at Banner Health Medical Center. Today, I will be explaining my senior thesis project, which is investigating isolated spring ligament rupture and its treatment protocol. A spring ligament is a thick, wide band of connective tissue that supports the medial longitudinal arc of the foot. It fills the gap between calcaneus and navicular bone. And this is the calcaneus and this is the navicular bone. As it attaches from sustentaculum tali of the calcaneus to the medial plantar surface of the navicular bone. The spring ligament works in concert with the posterior tibial tendon, which is the main dynamic stabilizer of the medial longitudinal arc as it attaches the calf muscle to the bones inside of the foot. The spring ligament consists of three main bundles: the superomedial, which is the largest out of the three, inferoplantar, and the medial plantar, which is the smallest out of the three. Injury to the spring ligament occurs through sudden forceful inversion of the foot, which can cause the ligament to stretch and tear. Acute isolated spring ligament injuries with a healthy posterior tibial tendon is very rare and uncommon and can result in acquired flat foot deformity. This rare disorder is often misdiagnosed as a medial ankle sprain by doctors. The goal or objective for this thesis is to describe a treatment protocol for rehabilitation of athletes with a isolated spring ligament rupture consisting of a surgical reconstruction followed by rehabilitation. My hypothesis is that the use of this treatment protocol would allow athletes who sustain acute rupture of the spring ligament to return to play at their initial level within 6 months of surgery. To answer this objective, I have looked at two case studies in the recent years that have looked at patients who have suffered an injury to the spring ligament. The first case I would like to mention is a case studied in University of Miami in 2016, as the researchers have looked at a male 21-year-old college track athlete that got immediate pain in the medial hindfoot after doing a long jump. A surgical intervention was performed on this specific athlete after being in crutches for about 6 weeks, and the surgery was performed in the regional block in supine position of the spring ligament. Once the surgery was performed and the ankle was immobilized for 2 weeks, 4 phases consisting of muscle, jogging, and weight activities were performed for 6 months. The first phase objective was to mostly restore the full range of motion. The second phase was mostly helpful in diminishing the pain. The third phase was more focused on higher level strengthening and full weight room activities. And the last phase was more focused on weight room activities and jogging exercises. The second case that I looked at is an Argentinian study in 2019, where the researchers had looked at 9 patients who have suffered an injury to the spring ligament. And the researchers have looked at their MRI scans and their previous injury and trauma background. Surgical treatment was performed if necessary, and a multimodal rehabilitation protocol was given to each of the patients. To understand whether this method was effective or not, we need to go and look at the data and the graphs in the results section. The first figure that I would like to mention is figure 4 for case study number 1, where they compared the FADI and the FADI-S scores between week 5 and week 28. An FADI is a subjective self-report measure with 2 components. The traditional FADI consists of 26 items related to activities of daily living, and FADI-S consists of 8 items that are designed for athletic populations. The way that this was measured was the subject was supposed to report how much pain they have for that specific week on a scale from 0 to 4. 0 indicating that they had unbearable pain at the operative site, and 4 indicating that they had no pain at the operative site. The scores were calculated into separate percentages out of 100, and both measures have demonstrated responsiveness to improvements in function following the rehabilitation. The main thing that I would like to mention in this graph is that you can see a increase in percentage from week 5 to week 28 for FADI and FADIS. You can see for the blue bar graph, you can see that it for week 5 to week 28 for FADI, it went from 66% to about 95%. And for FADIS, it went from 0% to about 87%. This graph has shown that has been significant effectiveness of the surgical treatment and rehabilitation protocol that was put into place in order for this athlete to return back to its initial level of play. The next figure that I would like to mention is figure 5 for case study number 2, where we looked at t-tests comparing the pre and post operative treatment. A t-test is very effective for comparing average values of 2 data sets, and it's used to see if there's any significant difference between 2 groups. And the values that I would like to stress more on this table is that AOFSA pre has a value of about 39, and the AOFS post has a value of 84. This shows that there is a significant increase in the treatment for the 9 patients. And the next figure that I would like to talk about is figure 6, where we talk about the empirical CDF and the interval graph. So for the CDF, an empirical CDF is basically a probability model for the data. Compared to a scatter plot, an empirical CDF is mostly used for limited data. And so what we can see is that there is a red line showing the post AOFSA post treatment, and we can see the blue line showing the AOFSA as pre treatment. And what we can see for the post is that the overall trend and the fitted distribution line they basically match each other. While for the post the pre treatment, the fitted distribution line compared with the data is not matching with each other. So basically, this kind of says that the improvement in the treatment for 9 patients has been really good, and the treatment protocol that was the multimodal rehabilitation protocol has been effective for all of these patients. And the next one is the interval graph. The interval graph is very useful for understanding, like the distribution upon the values. And so we can see that here 60 is about the median, and we can see that for the AOFS pre, we can see that the values go from 25 to about 55, with the center about 40. And for the AOFAS post, we can see that the value goes from around 75 to about 95, with the center around 85. This shows that the post treatment has been very effective because we're getting higher values compared to the pre treatment, which we're getting lower values for. So the kind of conclusions that we can come up with based on these graphs is that the case study number 1's result proved that over a period of 6 months, the subject achieved normal ankle range of motion and muscle strength, and no sign of pain at operative site due to the implementation of the rehabilitative protocol. The second conclusion we can come up is that the case study's 2 result proved that a surgical treatment in the peripheral area of the injured ligament and a rehabilitative protocol consisting of many phases was very vital for the patient's recovery. And the hypothesis was supported, based on these graphs and numbers. And it has been the surgical treatment and rehabilitative protocol lasting up to 6 months has been very important to achieve the initial level of play. And the future research that I would like to do I would like to continue to conduct more experiments and understand what type of treatments would be beneficial depending on the severity of the injury. Because these case studies, the injury was not as severe. So so these are the values and data sets that they have come up with. But depending on the severity of the injury, because the spring ligament injuries have different levels of injuries. There's a grade 1, grade 2, grade 3. So depending on the severity of the injury, maybe the treatment protocol will also change. And so more research, more people need to be involved in these studies, and then only we can get an overall trend about what type of treatment protocol will be effective. And these are the references that I have included in this poster. If anyone has any questions, I will please let me know, and I will happily answer all your questions. Thank you so much for your time.